Ma'am, what are you here for today?
Well, so what happens with breast cancer is women not only have to deal with the disease, they also have to deal with cosmetic issues. And I've never been one who's been terribly immersed in cosmetic anything. And the breast cancer came as a terrible shock, and the cosmetic dimension of it really took a long time to settle into my brain, because clearly I was going to have a mastectomy and reconstruction. And I think it was during those first few weeks after diagnosis I was seeing a whole array of doctors, specialists, who were all working to figure out exactly what type of cancer I had and what kind of treatment plan I would have. And in the midst of that, I started to see Dr. Davison, and I think the last doctor I ever thought I would ever have in my life would be a plastic surgeon, because plastic surgery just doesn't seem natural to me. But given the situation, I ended up looking at the choices between an implant or using my own body tissue. And it became clear very early on, the way Dr. Davison advised me, that I would be happier with what's called a DIEP flap operation, mainly because I travel a lot and I end up in remote places in the course of my work life, and any kind of infection or irritation, if I can't get to medical care when I'm away somewhere, would be quite difficult. So I not only faced 8 or 9 months of cancer treatment, after that I faced 9 months, really, which amounted to 2 years altogether, of stages of surgery with Dr. Davison. And I have to say, he just knew what he was doing. And he was terribly precise and amazing. He was very stubborn. He believed what he believed. And at some point when you choose a surgeon, you have to decide why you're choosing them. And surgeons are not exactly the people who provide comfort when you're unwell. But if they're good with a knife, and they know their craft, and they know their art, and they know their skill, you're going to be in really good hands. And I just was blown away, stage by stage, with Dr. Davison, of the kind of results that I got. And I went through a 6.5-hour operation, and then I went through, I think it was a 2.5-hour operation. And all this requires recovery time, and his staff could not be nicer. They were fantastic. I always felt I was in good hands. You're fragile. One is very fragile through all of this. And while the surgeon does his job of getting the dimensions right and getting the proportions and the stitching and the look and everything right, the staff also really understand the emotional side of it. So it's been a challenge that I never thought I would face, and one which has left me, frankly, looking a lot better than I looked before in my natural aging state. My body looks far younger right now. I love it because of all the different clothes that I could pull out of my closet that I hadn't worn in years. And I love the fact that even though I went for the long haul, the results are far more rewarding than I believe if I went for more short-term solutions. So I think it's important, if you're not prone to going to a cosmetic surgeon just for the sake of it, I think it's important to take all those prejudices and put them aside when it comes to the breast cancer experience, and think about the future and what you want that future to be after cancer. And I would say it was worth my 2 years. Mm-hmm. and they weren't easy years, but they were, you know, amazing. And I have all my doctors to thank.
Mm-hmm. Thank you.